We've got an event today to celebrate the progress of end-of-life care provision in England and also to look about how we can progress it further.
It's important to bring these people together because actually you can learn from each other. Somebody probably somewhere solved the problem that you're trying to solve.
I'm really excited because it's not often you come to these events, and so to actually meet other colleagues is just a wonderful opportunity.
There's a great opportunity to meet people who have an interest in end-of-life care and share our experiences.
It's fantastic. There's a really, really good buzz, and there's a sense of people being very energised by it and sharing that with each other and meeting each other.
And it's also really great to get professionals and people that have gone through the experience working together to see how they can solve and drive up quality.
It's vitally important that people network because people in various areas have good practice, and if we can share that, it helps to achieve our goal.
Welcome to this conference today. We're really glad to see so many of you. My name's Maggie Morgan-Cook and I'm the Programme Delivery Lead for the end-of-life care work that is commissioned on behalf of NHS England.
It's important to have events like these to give people the opportunity to come together and share learning, because otherwise these opportunities are too few and far between.
Many years ago, Dame Cicely Saunders made a very famous quote. It was about how people die remains in the memory of those who live on. And that is so true.
From my personal experience, sitting with someone when they breathe their last breath and holding their hand is the most heart-wrenching thing you can ever do.
I'm here today to establish a link between the people that care on the front line for end-of-life care and to try and get them to work with carers, enabling them to still have a caring role even to the end.
Working together is important for individuals and their families because collectively we can do an awful lot more.
We only get one chance to get it right, and we need to bring the services to support the patient and the family needs so that we can help them to live until they die.
I think it's crucial to have somebody that can be trusted, that is there and you know is going to be there to listen to every wish that you may have.
By bringing together all the resources from both the charitable sectors and also the NHS and statutory sectors means that we can really add value.
Caring for somebody who is dying, caring for the bereaved is a team effort. It's not any one particular profession or community, it is actually everyone working together in a harmonious fashion.
It's really important in end-of-life care that teams work together, and I think you see a real multidisciplinary approach to good end-of-life care, and that can really help the patient and their loved ones get through that traumatic situation.
We need to make sure we're getting it right, we're improving it, we're living longer, so we have different challenges, and we really need to look at the novel and different ways that we can, and innovative ways that we can work together.
The benefits of attending events like this is the opportunity to strive forward with best practice and be inspired by new innovations and way forwards to actually improve care.
We've given people the opportunity to engage in learning and sharing workshops. Some of them have been sharing their expertise, others have been taking a learning away with them, which we know they'll use to benefit patient care.
It's not just about the formal sessions, it's actually as much about the posters, the networking, the talking to each other, and the workshops.
When you have bereaved relatives, maybe if they need someone to talk to, no one to support them, maybe we could help out with that. And then you start to build that capacity, and then you just draw people in whatever way you can. That works organically and naturally. Death, dying and loss is not a health professional issue but a societal issue. It's the most important thing is about how do we create supportive communities around people who are dying.
We have to think about the wider context, because if we're going to improve end-of-life care for everybody, not just in acute hospitals, which is what we're here about today, but absolutely everybody, we have to think about the wider context.
Health professionals have got a really important role to play, but they must interact, support and enhance communities to enable them to care for themselves.
The goal for me is the best end-of-life care that you can provide. It can't be perfect for everybody, but at the same time, if we can get it as good as it can be, then we can't ask any more of people.
If the family feel that they have everything done and supported them, they actually cope better with their bereavement because they can look back and think, we did everything we could to support that person.
It's about how people can be cared for the people around them who love them. How can you feel comfortable and die peacefully knowing you're getting the support that you need? When we get rid of the pain, it's about what can that supportive network do to support people.
Often traumatised and extremely tired, carers still wish to continue to care until the end. Yes, this means caring emotionally, but it can also mean the act of physically caring.
There's also that sense of just a human connection that is very, very powerful and not to be underestimated.
People recognise the added value of partnership and working together to make our resources go further.
I'm really excited for the future. I think there is so much scope to do so much more.
I'm very proud of what's been achieved so far, but I also think that there is lots more that we can get better so that we get really consistent sort of high quality care for everybody.
I think people can die quite dignified at home, in fact more so at home than they do in the hospital.
When you network and talk on an informal basis, what you get is not just what works, but also what were the challenges, what were the things that didn't work, what are the things to avoid.
People in the UK are living longer, but not necessarily healthier lives. There's more people aged 90 year on year, and the number of centenarians has risen by 50% since 2002.
Sometimes it's not so much about what you do, but how you do it that conveys that kindness, that connection, that empathy.
How do you talk about dying without scaring the individual? Roberta?
I think a way of approaching that is to say, what do you understand about your situation at the present time? And then they start to talk, and quite often the subject will be approached. I do think the onus some of the time is on the patient to instigate the conversation when they feel the time is right.
Needs change and our choices change, so it's really important that we do think about how we still move that forward. So we've still got plenty to do, so complacency is not an option.
My own actual expressions of what I want at the end of life have changed, and they have changed partly by coming to events like today, where the opportunities to network and build knowledge of what is available.
So people have gone away today with ideas on how to address the challenges in their own organisation by learning from other people, which has been really great.
What I hope for today is that people will share their practice, they'll network, they'll talk to people that they don't know, they'll go back to their organisations re-energised and really wanting to progress this agenda further.
To work with the carers and allow them to care until the end is something that they will remember forever for all the right reasons.